Hello and welcome to Oxford Analytica's video briefing. My name is Katerina Fytatzi and I'm here with Chris Oates to talk about antibiotic resistance. Hi, Chris.
Hi.
There's been some exciting developments in the field of antibiotic resistance, and we're here to talk about that today. So Chris, what exactly happened?
Well, so antibiotic resistance, which is a really growing threat, and a lot of people are worried about it, that's basically that a number of bacteria worldwide, which we have been able to treat for decades because science in the 50s and 60s and even before found out a way to make an antibiotic that treated it. Those bacteria are now developing a resistance to it. So every time you treat a bacterium with an antibiotic, it kills almost all of them. There might be some that have mutated to develop a resistance. That one survives over time, that reproduces. And what we're seeing now is that antibiotics have spread so far worldwide and are often being overprescribed in hospitals and used in agriculture that the resistance that is a natural product of any antibiotic is now growing at an accelerated pace, spreading around the world. And many doctors and health officials are talking about a post-antibiotic age where the things that would get infected and cause fatalities in the 1800s and before are now going to reemerge. So the modern age of medicine part of it might be coming to an end. So that's one of the reasons why the breakthrough that happened, that was announced yesterday, or published, a study was published in the journal Nature, might be so important. It was the announcement of a new type of antibiotic that can treat tuberculosis, might be able to treat many other pathogens, and at least in mice it was found to kill MRSA, which is a antibiotic-resistant bacteria that often happens in hospitals. So you go to the hospital for one thing and you contract MRSA, which is not at all good for patients because we need to keep them in hospitals. So this was able to do that, and more importantly, I think, is that the way they found this antibiotic strain was by using dirt as a framework for growing these bacteria. Because of restrictions on laboratories, we use petri dishes and other sterile environments like that as a way to grow these bacteria, these microorganisms that we use for antibiotics. Most microbes can't grow in that, so estimates are about 1% of all microbes we could actually study in a laboratory. This technique, which uses kind of basically a soil framework to grow these organisms, could open up many, many more types of organisms, microbes that we could use for antibiotics. So it's being spoken of as the biggest breakthrough in 30 years. That being said, it is very preliminary, and this antibiotic that we might be able to develop from what we've just found, and I'm saying we, and I'm just talking about all the people out there who may one day need these antibiotics, is still very limited.
So this is all very promising. What do you think the future might hold then?
Well, one of the problems with the futures is that while this is an innovative method and it is very promising, scientists need to keep studying this, and they need to have lab equipment and they need to have salaries so that they can keep their jobs, and that requires funding. And funding for basic science research has been cut in most developed countries, and it doesn't look like it's going to be improved anytime soon, even though there are government efforts to increase the funding. Antibiotics is not something that the pharmaceutical industry is that keen to get into because there's not a lot of profit in it, at least at the moment, when most drugs can be treated by current antibiotics. Developing a new drug to replace an existing one that is cheap to make, there isn't that much of an incentive. So the economics of this aren't there yet, even if the science might be taking a step forward.
So do you think governments should get more involved or could get more involved and help out to create more opportunities for antibiotics?
I think governments certainly will get involved. It's the question of to what extent they get involved and which governments get involved. The bacteria that affect someone in the developed world might be something like MRSA that you would get at a hospital. In Southeast Asia, on the other hand, malaria is now becoming antibiotic resistant. And that is currently in the rural areas of Southeast Asia, but there is concern that building roads through those areas will expose more humans to those pathogens, and that might spread to that area. But that would be a very different very different task to research than what the developed world might have. So if the United States, for example, puts a lot of money into this project, that might go to target the bacteria that the United States need to. And even if at the most basic level, there's not much way to target one drug versus one pathogen versus another at the most basic level of research. As it gets more towards drug trial stages and when resources have to be allocated that are finite, it is possible that if not all countries are invested in it from all parts of the world, that not all pathogens get equal treatment as they need. So it might be an area where international health organizations get involved. That being said, again, it comes down to an issue of money. So it is a risk, and it's a growing risk, and it's something that governments and companies should be factoring into their long-term plans. From what the estimates are, not an immediate threat. It is growing. It kills about, drug-resistant bacteria kill about 23,000 people every year in the United States. So it's a real threat and a big threat. But the prospect of a post-antibiotic world is still probably a decade or two away, at least from being a major global issue.
So we have at least some positive news with a breakthrough yesterday, but still a lot of work to be done.
It is positive news, but in a very worrying story. So the worries are still there, and they're still very large.
Well, on that note, and if you would like to know more about this, please visit our website at oxfam.com. Thank you very much.